Good morning. It's good to see you here and to see the online just filling up.
That's right. So if you want to call it to order and then we can do introductions.
Call the meeting to order, and this meeting is now in session. Do we have a quorum?
We do.
Yes. I'm going to start with introductions with myself. And my name is Marilyn Massey, and I have represented Colorado Springs, and I'm the chair of this council.
Do the little mouth.
Thank you. Good morning. My name is Amy Keckler. I'm a social worker with Colorado Legal Services.
I am Terry Cassidy with Health Promotion Partners.
Remember to turn your microphone on.
Little voice,
It's the middle one.
the face in the
Well,
middle.
I guess it's not the middle one, is it?
Few-
There it is. I did it.
Hi, I'm Joe Roos, Colorado Springs.
Debbie Levin Stankiewicz. Good morning from Colorado Springs.
Jim Woodard, representing Teller County.
B. Babbitt, Northern El Paso County.
Laura Cronic, Town of Monument.
This is Melody Hanna, Pikes Peak AAA.
Shall we,
And Melissa Martz with Pikes Peak Area Agency on Aging. And helping us with our tech today is Cheryl from upstairs at the PPACG. So thank you, Cheryl. And online, Marilyn, if you want to go ahead and ask the folks online to introduce themselves.
would you start with person that's,
Mark.
oh, it's Mark. Okay, I couldn't see.
I know, I'll help you. It's hard to read.
Mark, would you introduce yourself?
Yes, my name is Mark Bowers. I'm with Fountain Valley Senior Center and the executive director.
Eric
Bidwell.
Bidwell?
Mhm.
Hello, Eric. Would
Hi,
you
good
announce
morning.
your name?
Yeah, my name is Eric Bidwell. I'm a manager with the Department of Human Services.
Thank you.
Maria.
Hi, Maria.
Good morning, Maria Cordova with the Independent Center. We serve Park, Teller, and El Paso County.
Okay, we're going to wait just a second in case there's another one that's online. This is wonderful, where we now have the choice to stay home in our jammies, or we can. So,
We have one more person, Amanda Banfield.
okay. Amanda,
Amanda.
can you hear me?
I am the Director of Pearls, community resource here in Colorado Springs, Teller as well.
Thank you. Okay. Do I have a motion to approve the agenda?
I'll approve
Debbie?
Debbie.
Second.
Okay.
All in favor?
All in favor, say aye.
Aye.
Raise your hand.
Aye.
Is there well, there's no discussion. Any opposed? That's what I was looking for. Any opposed with a like sign? And the motion carries. Do I have a motion to approve the minutes from October 26th?
I make a motion to approve the minutes.
And I'll second.
Okay, thank you. Is there any discussion? All in favor, say aye.
Aye.
Any opposed? Motion carries. I am not aware of any public comment to be, Jared, was there any online?
Spiel. We did not receive any grant request for public comment. I will ask anyone who's online who is not a RAC member to please use the raise hand function if they'd like to provide public comment. We do not have anybody in the room who is not already scheduled to be on the agenda or who is a member of the public. And as I have stalled for time for anyone online to use the raise hand function, I don't see any hands raised, so I believe we can move forward from public comment.
Thank you. Under action items, Melissa's going to explain about the voting for the officers for 2024.
Thank you, Chair. Normally, our membership chair would present this. However, she is out today. That is Rosemary. So I'm going to step in on behalf of Rosemary and just take a few moments to say thank you to the chairs who have been acting for this year, which include Marilyn as our chair, Debbie as our vice chair, and Bill as our second vice chair. So thank you very much to those folks who stepped in for this past year. And I'm happy to say that those same officers want to stay in their positions for the upcoming year. And with that being said, we can open it to the floor and to the Zoom room if anybody wants to nominate someone else to be in one of those roles or they want to nominate themselves. Otherwise, I will put the slate out with Marilyn, Debbie, and Bill to continue in their roles. So first, do I have anyone else who wants to nominate themselves or nominate another RAC member? Okay, I do not. And so with that, I'm going to present the motion and would ask for a second.
I second.
And any discussion, any further discussion? All in favor? Okay, so the motion carries. We have our slate of officers for starting January's meeting. We will not have a meeting at the end of December because today is our meeting time. But we will gather again in the fourth Thursday of January. And at that point, our chair, Marilyn, will actually look at appointing the people who are the chairs of the committees. So membership chair, TRS, SRS. And so stay tuned for that work in January. And I think that's all I have, Madam Chair.
Thank you.
And I'm going to hold on for, oh, but I see Sarah is on there. So, okay, great. All right. So we are ready to present. And if we can let Sarah share her screen, that would be great. And then Amy, you can go to the podium if you want and compliment Sarah's presentation. And I'll just go ahead. Chair, Matt, would you like to introduce Sarah and officially, or you want me to do it?
Why don't you do it?
Okay. So Sarah Lipka is with Colorado Legal Services. She is the managing attorney for Colorado Legal Services. Many folks are familiar with her and have seen her. And then Amy Keckler, who is here, is the social worker for Colorado Legal Services, which was a kind of a pilot thing that started. Has it been 2 years now or a year?
Yeah, we're at 2.5 years.
2.5 years and has expanded since it started. So so nice to see Amy continuing in that role. And at that point, I'll turn it over to Sarah to kick it off.
Thank you very much. Can you all hear me okay?
Yes.
Yeah. We can, but we are not seeing your screen.
You're
So I
not
don't
seeing the
know.
screen.
And I think that's
Mhm.
more possibly on our side to be able to give you the opportunity to share screen.
Can you see that now? Let me.
Does she need to push take control?
Okay, I'm going to try again. Let's see. Can you see my
Here it
screen
comes.
now?
Yep.
Yes. Okay, I'm going to try to do this while I'm showing the slideshow. Can you see the slideshow?
Mhm.
Yes.
Yes?
Yes.
Okay. Can you still see me?
Yep.
Okay, great. I'll talk for the first part of the presentation and then Amy will present for the second half. Thank you for having us. My name is Sarah Lipka, the managing attorney for the Colorado Springs Office of Colorado Legal Services. And I'm here with Amy Keckler, who is our social worker who is funded through you. And so we want to thank you for funding her position and for all the support you've shown for our new social work program, which has served as a model for other offices around the state. I'm not there in person because I'm getting over the flu and I don't want to get anyone else sick. But I've been really looking forward to this presentation. So Colorado Legal Services, our mission statement is to provide meaningful access to high quality civil legal services in the pursuit of justice for as many low-income persons and members of vulnerable populations throughout Colorado as possible. We're a statewide nonprofit agency. We strive to help as many people as we can, but we also want to provide really good, impactful work. And so we can't take everyone that applies for our services. And we try to triage so that we're focusing on cases that provide the most service for really important access to basic things in life. And then we try to prioritize members of vulnerable populations. Statewide, we have about 153 staff, 85 attorneys, about 45 paralegals, and 23 support and administrative staff in 13 offices around Colorado. We also have hundreds of volunteers, primarily volunteer attorneys providing services to our clients. So you can see since I presented that we've been growing, which has been great. And I hope that we can continue to maintain this pace of growth, which allows us to provide more services, but we're growing, I think, at a steady rate so that it's manageable. The Colorado Springs office remains the second largest office in the program. We now have 10 attorneys in our office. That includes me, though, and I don't carry a full caseload. We have 5 paralegals, 2 intake specialists, which are the folks at the front desk. We now have 2 social workers, 2 social work interns, 3 volunteer attorneys. And these volunteer attorneys do provide a lot of assistance to the senior population. 2 additional support staff, and then our office houses 2 members of our statewide management team. Here's a map that shows generally where all the offices are around the state, and we cover every county in the state of Colorado. So the Colorado Springs office serves El Paso, Teller, Lincoln County, and then we share Park County with our Salida office. We also share Chaffee, Custer, Fremont, and Lake County with other offices. On some statistics, and I always like to share those from the census website. 9.4% of Coloradans, according to the 2022 Census Bureau estimates, are living in poverty, which is about 548,953 Coloradans. The population of Colorado is now 5.8 million, and seniors, which is defined for census statistics as 65 or older, which is slightly different than the Title III, is 15.7%. I looked at the statistics in our service area for this grant, and I see that 9.6% of the population in El Paso County are living in poverty. 14% of the population in El Paso County are age 65 or more. And then in Teller County, only 7.9% of the population live in poverty. However, 25% of the population in Teller County are 65 or older. So 1 second, apologize. And then in Park County, 7.3% of the population live in poverty, and 23.9% of the population are age 65 or older. To qualify for Colorado Legal Services, generally, if you're not age 60 or over, you must be low income and low assets. However, for seniors, we can help anyone who qualifies regardless of their income or assets. Although we do target low income, low asset seniors. So what that means is if we have two seniors for the same legal issue, let's say we have two seniors that come to us for help with basic estate planning, and one senior is low income and low assets, and the other senior has higher income or quite a bit of assets. Because we don't have enough attorneys to help everyone, we will prioritize the senior who would not be able to hire a lawyer. And we may tell the higher income, higher asset senior to contact the local bar association for a list of private attorneys. So for people who are not 6 year over, this shows generally what is for our Legal Services Corporation grants, who would qualify for our services. And you can tell that the poverty rate, the poverty numbers are pretty low. So you can imagine trying to live with $1,521 of income each month before taxes, and imagine how more likely you are to encounter legal problems and how hard it would be to hire an attorney. People living in poverty are more likely to need an attorney statistically because they're more likely to encounter evictions, debt collection cases, and other things like that. So asset ceiling, again, for seniors, we have flexibility, which is nice. What do? We do civil work. Most of the work that we do is in 4 areas. Most people that are coming to us right now are coming to us for help with eviction defense work. And that includes the work that we're providing to seniors. A close second is family law work, which would be civil protection orders, divorce, and custody cases. We do help seniors in family law, and we prioritize seniors in our family law intake process. We try hard to look for protection orders with the basis of elder abuse, because I believe that it can be harder to see that if you're not really keeping an eye out for it. And so when we do have somebody apply for help with elder abuse protection orders, we try our best to make that a priority. We also do consumer work, which would include debt collection defense. We do foreclosure defense work. We do bankruptcies primarily as a defense to foreclosure. We've seen an increase in HOA foreclosures in recent years. And then we also do public benefits work. So that could include somebody who, hang on a second. Okay. That could include somebody who's applied for SSI and been denied. We can do that hearing. We can do alleged overpayments. We can help people if they have had their food stamps terminated inappropriately. We can do those administrative hearings. Here's a chart that shows case types. I think this is actually 2022 case types because we don't have all of our numbers in for 23. But you can see that housing is our primary type of case that we work, followed by family law, consumer, income maintenance, and then other things that we do. We have an ID project in our Denver office that we do a lot of work with in the Springs office. So if somebody doesn't have their state ID, we can help them to get that. And having a state ID allows you access to public benefits. We can do things like name changes or requesting documents from other states as appropriate. We also go with clients to the DMV and have vouchers so that we can walk people through that process, which can be challenging for anybody, especially when there's special circumstances in their case. Some examples of those, we've had some seniors who were born at home a long time ago and were never had a birth certificate. And without a birth certificate, it is harder to get a state ID, but we have attorneys that specialize in this. And so we can help with that. We have a low income taxpayer clinic, which is, we have a tax attorney in our Denver office who can help people who get letters from the IRS alleging that they owe money or other issues that come up, and that can be very helpful. We have a migrant farm worker division, which is not very active in the Springs office, but more down in the San Luis Valley, where our lawyers go to the farm workers camps and make sure that people are aware of their employment rights. We have a survivor services unit, which helps victims of crime with immigration work, which is limited primarily to helping victims apply for U visas or VAWA self-petitions. So that would include victims of domestic violence who are unable to get their citizenship through the marriage because of the violence. We have a telelegal partnership where we work with a hospital up in the Denver area so that the social workers in the hospital refer patients to us and we can help address legal issues. So an example of that could be, if somebody is in the hospital because of mold, they can come see us and we can work through the legal system to try to have the landlord repair the mold. Also, we work with Native American rights, and that's primarily in our Durango office, which is close to the two reservations in Colorado. I'm almost done with my portion, and then you won't have to hear my voice anymore this year. Last year, we provided legal assistance to about 8,362 clients. That includes non-seniors. In El Paso Park and Teller County, last year we provided assistance to 903 clients. 232 of those were seniors. In the first 4 months of our current grant cycle, we have provided 508 hours of legal assistance and 487.5 hours of case management to seniors through your funding. In the first 4 months of our current grant cycle, we have provided legal assistance to 101 seniors so far and case management services to 18 seniors. I'm going to hand this over to Amy now, and I'll keep going with the slideshow. Thank you, Amy.
Thanks, Sarah. So sorry, I can barely read it, so I'm going to squint. I apologize. In July of 2021, Colorado Legal Services began our client support services, or our social work program. I was the first hire here in the Colorado Springs office, and then we did expand on to Denver with other grant funding. But Title III is responsible for bringing social work to Colorado Legal Services, so we just want to say thank you. I am completely funded by Title III, so I only serve individuals over the age of 60. I am in El Paso County, Teller County, and Park County. In those 2.5 years, we have served 223 senior clients within those 3 counties. We do now have 5 social work positions within our organization. 2 of them are here in our office, and 3 of them are in the Denver office. And between our 2 offices, we also have 5 social work interns to be able to further expand what we can do. So the mission statement of our client support services program is to provide holistic support to help clients achieve the best possible outcome in their legal case and to sustain those results. Our vision is that our client support services staff are part of an integrated team, utilizing our skills to enhance the legal services provided, providing comprehensive support to our most vulnerable clients, and allowing the attorneys and paralegals to do what they do best. And so we do all truly work as a team, the paralegals, the attorneys, and our social workers. Typically, the clients that are served by our client support services program are those with the complex financial, social, emotional, and medical needs. Those who really need that additional support to take their legal win and build stability moving forward so that we don't need to see them again. Sarah, if you don't mind the next slide, please. So I do have 2 case examples that are senior specific from our region that I wanted to share with you. So we're going to call this fellow Jim. He is a 75-year-old from Teller County who was being evicted from his mobile home. He did own the mobile home, but of course has to pay lot rent, that continuous battle. And you could tell as soon as we drove up to his home that the park was really focused on flipping those model homes. And so, or not mobile homes. And so he was being pushed out for really petty little details. And so an attorney was put on this case and really quickly got to work. So the mobile home park was demanding that Jim make really expensive repairs to his home, including replacing stairs that are never accessed, replacing the trim around the exterior of the home, just so many things that did not really need to be touched. And Jim did not have the money to do this, and Jim did not know how to fight for remaining in his home. And so our attorney was focused on the legal work, and I was able to get involved to partner with different organizations in Teller to find money to make these repairs for him. So thanks to other nonprofits in Teller County, a really generous handyman who lives down in Teller County, and family support, we were able to pay off the repairs needed and make that legal battle go away. Fortunately, the landlord came back and tried to bully Jim, and so our attorney jumped back on. And again, we were able to do what was needed and help Jim save his home that he had lived in for decades. So that's just one of the examples of how we're able to partner our social work and legal work to help. And Sarah, if you don't mind, the next slide, please. Rose is a second example of the attorney social work partnership. She is a 67-year-old who we actually got from our outreach at Fountain Valley Senior Center. She was requesting help in divorcing her abusive husband, who she'd been married to for decades. She had just undergone her own personal transformations that helped her recognize she was in an abusive relationship. And that in and of itself is a very big process. Like I said, she'd been married to him for decades. So an attorney was assigned to help process the divorce, and I was brought on to help her process the emotional baggage that comes with leaving your abuser and your partner of many decades. We did realize that Rose was not receiving her full SSI benefit every month, and she was not aware of that. And so we brought on a second attorney who was able to look at her income source and fight to get her full SSI allotment to make living on her own even feasible as she left her partner. It also became apparent that Rose was suffering from some depression, understandably, and also was just very lonely. And so thankfully, we were able to get Rose connected with the PACE program and get her in some counseling, and also get her linked with some of the social aspects that come from being a part of PACE, and to get her a little more involved with Fountain Valley Senior Center's programs as well. And so just speaking with Rose on the phone, you could hear the difference in her confidence, in her happiness, and she was able to process a little bit more what life without her partner was going to look like moving forward. And so between our team of 2 different attorneys and myself, I think we got Rose a pretty nice outcome, something that she probably hadn't been able to imagine for herself when she first walked into Fountain Valley Senior Center. And then just our last slide, we did want to highlight, we do outreach. So I did mention Fountain Valley Senior Center. We go there monthly. We also do outreach at Teller County, Teller County Senior Center, Tri-Lakes Cares, Aspen Mine Center, and we go to Fremont County's courthouse weekly, actually. And so we do have staff present to meet people who are unable to drive into the Springs to have a little consultation. And we're also able to just spread the word of what we're doing when we're at these outreach sessions. And so I think it's beneficial for us and for residents that don't live here in the Springs. Outside of those outreach, we also do Legal Resource Day every year, as well as Family Law Day every year. And these are opportunities for people to come in. They can sign up to speak with an attorney for like a 15-minute free legal advice session. They can also just meet other providers from the community at these events and discuss a wide array of whatever they're dealing with. And we also do estate planning trainings. We host them at the library. We host them at our different outreach centers that I mentioned. Our volunteer attorney, John, has gone to a senior apartment complex and done estate planning there. So he's he's an amazing volunteer, and he's open to going kind of wherever the need is. And our estate planning presentations are always very well attended. And lastly, we do have landlord tenant law presentations that we partner with other organizations in the community to teach renters' rights to the community as well. Did you want to add anything to that, Sarah?
No, thank you very much.
Do you guys have any questions for us?
Yes.
So where do your social work interns come from? And I'm wondering if you have legal interns from any law schools in the area.
Yeah, the social work interns currently in our region, we're working with UCCS. I'm also trying to start the conversation with CSU Pueblo. And up in Denver, they're working with MSU and the other, sorry, I'm not from Colorado, the other really big university up there. And then, yes, Sarah also works with law students if you want to talk about that part.
The two law schools are in Boulder and Denver in Colorado. So we try to focus on getting folks down here in the summer. This summer, for the first time, CLS will be offering a stipend to interns. And we'll be able to have one paid law student intern in our office, which I'm really looking forward to. And then we take volunteer attorneys who can provide at least coming in at least 1 day a week for 6 months. So that's mostly retired attorneys. There are a lot of attorneys that would like to take a pro bono case on. We work very closely with the Justice Center, and so the Justice Center will take those volunteers, and then we can focus on taking the volunteers that really want to commit long term to, and then we treat them just like normal staff. So
I think that's great. And I just want to say that the more people we can get to learn about seniors and the kinds of services that seniors need, either social work or law or people who may become lawyers, I think that just benefits the population immensely.
Agree.
thank you.
So you talked about hours and cases. Do you have any way to measure whether you're successful with a case? Or whether the client's happy, or I don't know quite how to think about it, but more than just inputs, you know, how are you doing and how you knowing you're getting better or whatever that is?
Yes, we do track outcomes when we close our cases. So we can track how much money we've received for a client or how much money we've prevented somebody from taking from a client. So that would include, you know, if we win a debt collection case, we can keep track of that. Or if we get maintenance or child support, we keep track of that. We also track other outcomes such as obtaining a permanent protection order, getting somebody divorced, you know, with final orders, getting maintenance, getting a custody plan in place, or, you know, successfully working through the public benefits. So we track both soft and hard outcomes.
We're also trying to work to gather feedback on client satisfaction. So we do have a survey that we have in our lobby that's a voluntary survey. We're trying to work on improving participation rates. And from a social work lens, we also measure data on somebody's stability when they come in, like when we first meet them. And then when we're closing the case, their stability based on like a ranking system to see if we numerically have made any sort of input on their stability as they leave.
I just wanted to share that I was a legal intern at Provo Legal Services when I was in law school in 1987. And it was really eye-opening. And one thing that was really eye-opening was I was in their meetings, one of the weekly meetings, and this woman looked at me. She says, "You don't remember me, do you?" And I said, "No, I don't." And then she told me, and I served papers. I was a deputy constable to pay my way in law school, and I served her husband a divorce paperwork, and I knew she was afraid of him. And he answered the door, and then I left and did my other deliveries. And I stopped on the way back to make sure she was okay.
Oh, wow.
And she said she'd never forget that somebody cared. So
That's wonderful.
that's my social work background.
And legal.
Thank you for sharing.
Mark.
Mark, did you want to share something?
Yeah, I just want to share that I'm out here at Fountain Valley Senior Center, and actually I've been here for now 5 years, and we have had them come in once a month, a representative come in, and they have helped countless number of seniors, and the seniors just rave about one individual who's come down, and he's now retired. But they provide an incredible service, and we are so happy to have them come down here once a month and be a part of services that we can provide. And we look forward to continuing the relationship with them, and I really appreciate what you guys do. So thank you very much.
Thank you,
Thank you
Mark.
very much.
This is B. I'm not familiar with that stability measure. Could you tell us more about what's in there? How do you determine how stable a person is?
Well, this is an ongoing debate in the field of social work. Trying to measure people with numbers can be really difficult. But best practice, we have different domains that we assess. So somebody's access to transportation, to healthcare, their income source and amount, if they're housed, if they're educated. We look at a bunch of domains, and we loosely try to identify like what would equate to a numerical value of 1 being the lowest and 5 being the highest. And so, for example, based on our specific stability matrix in the housing domain, a 1 is somebody who is homeless or imminently facing homelessness. And a 5 would be somebody who is stably housed and building equity within their home. Typically, if I'm working with someone on an eviction case, they're a 1 or a 2. They're like facing homelessness imminently, or their home is not habitable. Ideally, when we close a case, we're looking at a 4 or 5, someone who can afford their rent, someone who is safe in their home and they want to be in that location, somebody who is able to save money after paying rent and their whole salary or income's not going to that. And so obviously there's a bit of interpretation, but we use those scales to try to show a numeric gain, or sometimes unfortunately decrease, in someone's stability after we've worked with them. Is
Thank
that
you.
helpful?
Very clear.
Yeah.
Jody, would you like to talk?
Yes, I would. Thank you so much, Madam Chair. Good afternoon, everyone. Well, it's afternoon here. I'm in Virginia at the U.S. Aging Conference and board meetings. And so just wanted to share another reason that we haven't really shared as much, because now we're kind of into the multiple years of this program. But when Sarah first approached me about some of the concerns she was seeing, she and other staff were seeing, was really a utilization of resources. The challenge came that attorneys were spending time trying to find resources for clients who they were seeing again and again and again. And so there's this repeat of very similar issues without any solutions. And so, when we think about what an attorney is billing for their services, even through Colorado Legal Services, it became a concern that, are we really using our attorneys, in the best way possible. And through a lot of discussion with our staff and with Sarah and some of her leadership at the state level, we were able to craft this case management pilot in such a way that Amy and the other case managers are under the same privacy rules as an attorney with that client attorney privilege. And so when folks come to Colorado Legal Services, either before they meet with an attorney or after, the case managers can be part of the solution to ultimately drive that person to a solution driven, not just let's solve the case now and oops, 6 months, a year, 2 years down the road, we're right back where we started because we solved the issue at the time, but we didn't look forward with long-term solutions. And so I'm really excited about this. We have shared this at both the state and the national level around this pilot and how it's ultimately helping people not just get their immediate needs met, but their long-term needs met. And so I'm just really excited to continue to see this ongoing work, and really wanted to kind of take a step backwards and because many of you on the RAC were not part of those early days during the pilot. And so I think it's important to understand this is not the norm. Colorado Legal and Region 4 area, Pikes Peak Area Agency on Aging are being recognized as a leader in this methodology to ensure that people see those long-term helps so they can not just fix immediate, but move out of the issues entirely and receive those supports that they need across the community. So again, well done, Sarah, for bringing that need, and Amy, it's been a joy to get to know you and see the work that you all are doing. So keep up the great work.
Thank you, Jody.
Thank you, Jody. That reminds me of a story I've probably shared when Amy first started. We had a housing client who was facing a really difficult eviction, and one of our lawyers did great legal work and got the case dismissed. And I won't get into detail, but the way that he did it was like really good. Never happened. I was so proud of him. And Amy came to me and she said, "Oh, I'm so embarrassed because she's going to get evicted next month." And that's the difference between a lawyer and a social worker, I think, Yeah. And so by working together, we could, fight the legal cases and get the client more stable so that she could stay in her home.
Thank you. Oh, Jen, would you like to say something?
Yeah, I just had one last remark. I love the program and the services that you're doing and appreciate what you're doing for our community. An aspect to the hiring with the interns, I really am interested in how that works for intergenerational work with our younger populations and serving our seniors, because that relates with our 4-year plan and serving kind of in a broader area. So that is very exciting for me. When you're talking about the stability score, I'm curious if you use any other social determinants of health and if you've considered using that screening tool from the American Academy of Family Practitioners.
That is very timely. I actually have a meeting this afternoon with our social work team. We're trying to revamp how we measure. So I'm going to take that with me. Thank you.
Okay.
It's very difficult, like I said previously,
Right.
just to measure human impact because it's so unique with everyone, but we're always looking for the appropriate tool. So I will take that and look at that this afternoon. Thank you.
Yeah, you're so welcome. If you have questions, just let me know.
Yeah, I will. Thank you.
And I'll just add one more comment. I worked at an area agency in Spokane, Washington, which is the same place that Gonzaga is located. And Gonzaga had a law school, and they partnered with our area agency, and they used all of their students to participate in a legal program to provide the kinds of things that you're doing, which greatly expanded the kinds of services that our area agency could do. So I'm really glad to see that you're using legal interns.
Oh, yeah.
I'm
Thank you.
impressed with the fact that you're so widespread isn't the word, but what I'm saying is you have much more legal services than I knew you did.
Mm-hmm.
And I think that you also are, you're here to look at the individual as a person and not just as somebody that's getting thrown out and or they're but I like the fact that you can follow through, because my undergraduate is social work, and that affected my being a deputy constable because I read the paperwork. And that's how I was able to meet this woman. But I really like the fact that we do this on a monthly basis where we get to meet and hear what you're doing.
Mm-hmm.
And I thank you. I think you're doing good.
Yeah. I think our senior services in our region are just very interconnected. And I love, Melissa, I feel like you're a huge reason for that a bunch of the providers, we come together regularly and we're able to just talk about cases right then and there. And I think that really helps better serve our population here. And slight tangent, but from what you said, I do have my business cards. If you ever just have a question about like, can we do this? Or do you have any ideas? You can always reach out to me directly or to Sarah directly, because not every situation is black and white, and it's really hard to provide a full picture of what all we can do. So if you want those, I have those.
Any further discussion? Thank you.
I did want to, forgot to mention that we moved about a year ago. So we were in the same location for over 40 years. And now maybe Amy could tell you where we've moved to.
We moved a couple blocks north. So we're at 102 South Tejon. We are one of those tall buildings right by the courthouse. It says PNC Bank on our building. And so we're on the 4th floor of 102 South Tejon. And we have coffee and comfortable lobbies. We like, even if we can't help people, we can just give them a warm place to come in for a little bit. So we like to be as welcoming as we can.
And they can be heard and felt somebody was
exactly.
interested in helping.
Exactly. Thank you.
Okay, thank you.
Next one. Thank you.
Yes, I'm going to learn because I don't know what you do, sir.
So I'll go ahead and introduce Terry Cassidy with Health Promotion Partners. So we are grateful to have Terry as part of our service group. And Terry is an occupational therapist, but also the founder and owner of Health Promotion Partners.
Knew there needed to be a light. Hi, thank you so much. Yeah, I'm excited to be able to be here and talk to you all today. This has been our first grant cycle, so I haven't met most of you or gotten to do this in person. We have 2 different programs. Let me just fast forward here. So the company is Health Promotion Partners. We're an occupational therapy. We provide occupational therapy services in the community. We have some grant funding through CDOT that is related to education and outreach, but we've never had any funding for our lower income seniors in particular who need our services. So we do a lot of our services are private pay, Veterans Administration. We have a couple funding sources, but there's always been this category of folks who call, and what I'll talk about is the driving evaluation, who really need a driving evaluation and haven't been able to have a way to do that. So the funding has been just fantastic in that regard. Our other program is the Caregiver Skill Building Program, Skills to Care. And so I'm just going to talk about these separately and then open up for questions. My background is as an occupational therapist, worked at Penrose Hospital for 17 years, and ran the driver rehabilitation program there until they closed. And so that's when I went outside of that system because there was nothing in the community. So that's been about 5 years that we've had that company. We've grown quite a bit. We have an office in Westminster and an office in Fort Collins as well. And we have in this office, we have 4 occupational therapists that are also driver rehabilitation specialists serving clients, most part-time. Here's our car, just to give a little frame here. One of our cars, this is our elderly car here, actually. But we do actually get in the car with clients. So I'm going to just talk a little bit about driving in general and what we do, and then the clients that we've seen that have been funded through this grant funding. I wanted to put this in here. This week is Older Driver Safety Awareness Week. So thank you, Melissa. Perfect timing for us being here today. It is always the first full week of December. Part of the timing for that is specifically because it's between Thanksgiving and Christmas, a time when families are coming together, maybe seeing relatives they haven't seen in a bit, maybe noticing some concerns they didn't notice last year. And so the idea behind Older Driver Safety Awareness Week is to have this be a conversation for people to be talking about driver safety and just have some awareness and some planning involved there. So CDOT did send out a press release. I did an interview with Denver 7 News over Zoom, and so that should air today or tomorrow, so I can share that. If I'm always like, if I like it, I'll share it. And then talking to someone today. So there is at least a little bit of press pickup on it, because I think driving is one of those topics that is traditionally been pretty personal, and people are very hesitant to talk about. People who have maybe questions about their own driving are really scared of someone telling them not to drive, so they're hesitant to talk to other people about it. So part of, like, on the outreach side is just talking a lot to medical professionals about this topic and the public, just to make it be more of a normalized conversation. So the theme of this week is understand, be proactive, and plan. So just having these discussions. Just a little bit like particular to Colorado. Colorado is considered a self-report state in regard to driving. So some other states, there's mandatory reporting for physicians. If someone's admitted to the hospital with a stroke, for example, they would not be allowed to go back to driving until they're cleared by their doctor. That's not the case here. Technically, the self-report piece is what I have on the screen here, this medical clearance to drive. So when any of us go to renew our driver's license, we're asked this question: during the last 2 years, have you had any physical, mental, or emotional condition that would interfere with your ability to operate a motor vehicle safely? And it gives these examples. Most of us check yes, say yes, don't really even realize we were asked that question, but we all were at one point. What happens if someone, when I first started doing this, it was a lot of people in the medical realm because I was working in a hospital. So I would see somebody and they're recovering from a medical event and asking about their license and can I get back to driving? And so part of building our program was to have a place for people to do that, to get the medical clearance. Yes, their doctor can approve them to go back to driving. I would say in about 100% of the cases, their doctor's not getting in the car with them and actually assessing their driving. So we really are helping collect data for the whole decision-making process. And then if you'll notice on here, it gives the examples: heart problems, diabetes, paralysis. No mention of brain injury, no mention of dementia, no mention of really anything very neurological in here. So this just goes back to statute, so it's not been changed in a long time, and that's a whole nother topic that I won't go into. But so we're doing a lot of education just for people to have an idea. And with dementia, it's often family members of that this could affect driving, how it could affect driving. And even though it's not written in that question, it's still something for us to be thinking about. Overall, we like to use the kind of stoplight model here. So this we talk about when we talk to medical providers, but also to other people in the community, of not every person needs to come have a driving evaluation. There are going to be some people with impairments that it's just kind of clear that they shouldn't be driving. Sometimes more, so oftentimes if it's more of something physical, where there's not going to be a recovery. So there's just risk factors that are clearly beyond safe driving. And then there's people who go through something and are doing great. So we're really trying to see the people in this yellow category where my dad has a dementia diagnosis. He's having a little bit of memory problems, but he's still driving and seems fine. Can you help us decide if he really should be driving or not? So we're really trying to target our services to this yellow category. There's a little bit about what our evaluation looks like. So we spend 3 hours one-on-one with the client. We are spending about an hour and a half in the clinic. So we're looking at the skills related to driving, vision, but more than they test at the DMV. We're looking at contrast, which would impact night driving. We're looking at a lot of different aspects of vision, sensory and motor, certainly just the physical things. And we also do have adaptive equipment that we can train people on. So if there's something physical, often that can be overcome with equipment. And then a lot on cognition. So kind of this multitasking piece. We have some dementia screens that we'll do, and then anything specific to what's going on with their particular diagnosis. So people are often like, I don't know if scared or impressed that we get in the car with some of the folks that we see, but we really have a lot of information before we get in the car. So we do need to do this clinical eval first, so we kind of know what we're at least looking for. It doesn't always dictate what's going to happen in the car, but it gives us a lot of background. And then we go in the car. So I showed you that picture of our car. We have vehicles that have a gas and a brake on the passenger side. So most people want to drive in their own car, and I completely understand that. But we are required to be in our vehicle for that, for our own safety, basically. And we'll just start in the neighborhood. So there's some folks that we see that we don't really get out of the neighborhood. Like, we have enough information by that time. There've been a couple, I'm not sure we're going to back out of the parking spot just because of visual or physical things. But for most people, we've been driving a long time, and driving is a very overlearned skill, to where some people can have some cognitive deficits, but it's really not affecting their driving yet in a low demand environment. So those are the types of things that we're looking at. And then here, increasing the demand. So we have a standard route that we take. Sometimes we will, if someone is near, so there's occasions where we will go and drive their familiar routes, for example, or work on navigation as part of that eval also. And then lastly, we come back and discuss it. So we do recommend, well, we require that someone gets a ride to our office, which the positive part of that means we usually have a family member there for the discussion at the end. And so we definitely leave time for that. Fit to drive, self-explanatory. If we're recommending that this person no longer drive, we will tell them our recommendations there at that meeting. The information will go to their doctor. We don't submit anything legally in Colorado. OTs can't report to the DMV. So we don't report anything directly to the DMV. Any of that will go through the physician. And there's a in-between phase in here of return to driving with restrictions. And I'll talk about that a little bit more when I talk about cases. And then we help fill out the paperwork that goes to the doctor, to the DMV. There are some people will do training with, certainly for recommending equipment, we will see them for training. Sometimes most commonly, I would say after a brain injury or a stroke, we will do training. A lot of the people we see, it is a one-time evaluation. We kind of do this. For a lot of them, we're going to recommend that they come back if they have something progressive that's going on. But for a lot of people we see, it is a one-time 3-hour evaluation with the written report. And that is what the grant has covered. So starting in fiscal year 2023, this basically is the amount of funding that we've had was for about 10 evaluations. So we used that in 2023. Some of that was getting the word out to providers to know, because they would be like, well, I know this person can't pay privately, so they don't refer them for a driving evaluation. So that's been nice to be able to have that awareness. We have used up all of our funding for fiscal year 2024 by October. So we're working on our waiting list now, but looking at some other options there. Something that's been really cool is that we've had a couple of people call and say, I can afford half of, so the driving evaluation is $480 for the 3-hour session. That's the private pay rate. And some people are like, I'm not going to be able to do that, but I could do half of it. So we've had a couple of people make donations to the program. So we've actually been able to do 2 additional evals from pooling money from some other participants who could pay off. So that's been a really nice addition to just kind of grow that side. I just pulled these numbers this morning in terms of like who we have seen through the grant in this fiscal year. 80%, so 8 out of the 10 maybe didn't have a dementia diagnosis, but that something related to cognition was why they were coming. A couple did have a specific, like frontotemporal dementia was the diagnosis. Some had memory concerns. Some had more subjective things that family was reporting around cognition. Mild cognitive impairment is something we see quite often, not technically dementia, but potentially progressing to that. The other 2 had a stroke. So mild stroke, family doctor wondering if they're appropriate to get back to driving. I was kind of surprised to see this actually, that all of them technically said they were fit to return to driving in some capacity. So I will kind of emphasize that part. But none of those, which I would say in general, probably 20% of the people we see it's recommended that they stop driving. So out of this group, that wasn't the case. Most, well, 50% had some sort of restriction. A lot of times that's a daylight driving only restriction. In Colorado, these restrictions can be added to somebody's license. So they go through the process with the doctor and the DMV to have that. One had a 10-mile radius restriction on hers. A lot of times we will say like a familiar locations, which is a recommendation, but the DMV doesn't like that because you can't really, if they get pulled over, you can't, oh yeah, I'm familiar with this location. But a lot of times the people we're working with generally drive to the same 5 places. And that's really all they should be doing, in our opinion, when we're recommending that. So really being clear with sometimes the family is a big part of that as well. A lot of times, so there's so much I could talk about, but if we don't believe the person's going to follow through the restrictions, then we don't make those. Then the answer would just be to stop driving. And so we kind of put that, and we'll oftentimes talk to the physician as well in making those decisions. One particular person that I wanted to mention was referred to us because of multiple crashes, which is always super scary to me. Like that's a huge just red flag with driving, obviously. But getting into it, when we met her, the first crash was she had totaled her car. Her son had died the day before. And so there was just, we can only imagine, like just a lot going on. So distracted, I'm sure. But then she had multiple, and these were kind of in the physician's notes and in family reports. She had scraped the right side of her car on her garage twice, bumped against another car. So other than that, they weren't major things, but still things that like, something's probably going on. She had stopped driving at her children's insistence and then was referred to us. And actually, I was looking at the notes from when she called. I was her primary care doctor, and she said, they wanted me to come last year and I put it off. So now I'm finally coming. So perhaps funding was an issue for her. And so I'm glad that she was able to come and do this. She actually had surgery to raise her eyelids. So I can't remember what that's called, but that's surgery. So she felt like her peripheral vision was much improved after she had that done. She came and did our drive and was approved to drive in daylight hours. So that is just one example. A lot of people, and then I was reading these reports this morning, it's not their choice to come to us. A lot of people, what I saw today was a spouse in most of these cases. I think I'm a great driver. My wife has concerns. I told her I would come to ease her concerns, which I get. I'm always like, we can help save someone's marriage by doing driving eval. I'm all for that. We're in there. I think that's my last one on driving. Are there driving specific questions?
How long is this? The trail that you let them drive on to evaluate, how many miles is that? And you get on the highway?
Good question. So we spend about an hour in the car. I think mileage wise, it's 12 miles or so. It varies depending on how things are going, certainly. But our full standard route, yes, if we go on the interstate, we go through downtown, we go kind of across town. So one thing we're looking at is fatigue. So we do want to have it be a lengthy session just for that of like, was there a lot of distraction just on the second half of the drive, not on the first half? So yeah, that's a.
Well, I'm very impressed that you are doing this because I know several people that need it.
We all do.
And I know one person that did take a course, and it may have been yours, I don't know, but he was approved to drive and he had his license back, and both of these people are in their 90s. Oh, wow. And we all had a heart attack that he got his license back, because I had refused to ride with him 4 years ago. And taking the keys away is a really difficult thing for most seniors. And every once in a while, I see the kids looking for dents. And I think that we need to be aware of that as the person doing the driving. So after I criticized his, I checked my own, and there were things I needed to change. So that was the positive of being afraid of his.
I appreciate that, though. It's a very sensitive topic. It's very much tied into our identity. Like, it's not just transportation for a lot of people. It's part of who they are. It's part of the roles they fill in their lives, driving their grandkids home from school. Like, there's a lot of things that it relates to. So we do really understand that and talk to clients about that, especially if we're recommending cessation of driving. We do. I love having the getting around guide from here now. Like, we do give resources as well. But it's a touchy one, and we're trying to make it less. We're trying to, like, the thing I like to talk about is the research is showing that most of us will outlive our ability to drive. Men by 10 years, women by 7 years. Nope, backwards. Other way around, because of lifespan. And so I would love to see that, where more people are willing to be like, not do I have to give up driving someday, but like, at what point? Like, we all will if we're lucky enough and live healthy enough. Then we need to have resources like things that are offered here.
I did not know that there could be a limit on where they can drive and back, because one of these people drives from home to the church and back. And I didn't realize that was possible, because we're saying, how did she keep her license, And thank you, because that makes things more understandable. And she follows that to a T. She does not drive anywhere else.
Do you find that the new safety features on cars, now some of the people you're dealing with may not have newer cars, but eventually, do you think they're helpful or do you think they're confusing? That's a great question. And we do, like, in our practice, work with all ages. So I think as a whole, I really like the safety features that are out there, particularly, I mean, certainly the backup camera, which is pretty standard now. I have a couple of clients with older than that vehicles. But the blind spot detection, I think, is another good one. Even for us, that car I showed you doesn't have those features, but the cars we use more as an evaluator, it's very nice to have the car beep instead of me being like, you're too far over, So But the lane. The lane detection, I'm sorry, different than blind spot. And also, I don't know how many of the older folks you are serving have smartphones, but obviously you can use that to get places. I don't know if that's helpful with people who may have some mild dementia, or even,
Sometimes
you know,
it
if you have
is.
a home thing on it, it'll give you directions on how to get home, if that's helpful.
Yeah, so I think there are some things that are helpful. A lot of people turn off those features in their cars, I will say honestly too. So a lot of we're trying to encourage them to keep those buzzers on. But in terms of the GPS, sometimes we'll incorporate that into our session if that's something, if they're having memory concerns and that's something that they use regularly, we'll start the eval without it, but then incorporate and see. For some people it's distracting and for some people it's helpful.
I think as people get older and are used to using those things because they've had a cell phone, that will probably be very, very helpful.
I agree.
Jody would like to make a comment. And then Jen.
Yeah, it's so good to awesome work. For those that don't know, and Terry did allude to it, but she's been doing this for a long time, and we had the opportunity to work together while I was with the Alzheimer's Association. And even though it's been touched on that, you know, children having to have this discussion with parents, or parents not really wanting to have their keys taken away, but sometimes the opportunity to have a third party, independent party, actually gauge the ability became so important for some of our clients that she would see, and really help the family understand that it's okay for a little while longer, or have that difficult conversation alongside the family with the individual that it really isn't safe anymore. Concern. So just wanted to share, I really appreciate this type of service, because in my years within senior services, unfortunately, this has been an ongoing conversation in all sectors, where folks come to us and say, how in the world do I have this conversation? And this type of service is timely, but also is constructive to really help that person understand. Talking about from the dementia side, I believe, Terry, I think you had shared with me some time ago some scenarios where, by using the business car, your car, those with some mild impairment or cognitive impairment, whether it's to the level of dementia or Alzheimer's, when because of the muscle memory that was alluded to earlier, they get into their own car, they know where everything is, they go. I think the reality of getting into someone else's car, I believe you had shared a story a while back where that just freezes some people because nothing is normal per their car. And so I wondered if you put you on the spot, but maybe speak to that, because it really does, when we talk about it from a dementia or cognitive impairment level, that's crucial, because muscle memory can hide so much of those concerns for so long. But then if something new is inserted into the process, then it becomes much more apparent. Would you share a few minutes on that?
Sure. Thank you, Jody. Yes. So there's definitely that piece. And there's, like I said, there's some people who just are very adamant about being in their own car, which I understand. My mom never drives anybody else's car. Like, it's very much their familiar place. The reason we do the standardized route, the reason we do these pieces is to kind of have an even playing field in terms of evaluation. And so we will always do the evaluation in our car. We can often get an idea within like the neighborhood setting of sometimes if it's just like a new car and they're just getting used to it, or if just this shift cognitively is way too big of a shift for them to make. There are times where somebody will be pretty borderline in terms of the evaluation in our vehicle, and we can offer, it's case by case, but sometimes we will say, we could do a shorter version of this in your car, in your neighborhood, to those 3 places you drive only. So it is case by case on that piece, but some of that is also looking at what their scores were on the cognitive tests, what their family support is for a restricted driving radius or destinations. There's a lot of like personal factors that go into that too. But yes, it's a lot to ask someone to do. Like when they come for this 3-hour eval, most people are pretty exhausted at the end of it.
Yeah, so my question was about the number of evaluations completed. It says, 10 and 23 and then 10 and 24 between July and October. Is it 10 because it's limited to the amount of funds you've received, or 10 because of the capacity that you're able to do with the current staffing?
It is related to funding.
Okay.
So when I was looking, so we see a lot more clients than that. So about 4%, I would say, is through the grant right now related to the funds that we have available.
So more funding, you could do more clients.
I would think so. Yes.
Okay. The other question I had is, if this type of service would, I'm looking at it comparatively to like a driver's ed course. When you're in the early stages of getting your license, younger drivers have that benefit of, oh, I completed driver's ed, and there's a benefit in their driver's insurance. Is there similarly something that would be for seniors that would motivate them to take this type of a?
Wish there was. We get asked that a lot because there are the things through AARP, the Smart Driver program, where you can get an insurance benefit. I think we just haven't had the lobby to make that happen. I'm like,
sure.
So not currently. I think I had 2 clients ask me in the past couple of weeks, and I said, please ask your agent if there's a way to do that. So I'm asking people just to advocate CaseKit, but I don't have like a set like discount on your insurance. I have over the years had 1 or 2 people come because their insurance company required it. I think it was when they turned 80. They had to have an evaluation for them to continue to cover them. It's rare, but that was kind of an interesting thing. Yeah. I think it makes sense on the insurance side.
Yeah.
To have some data behind the decision.
Sure. Yeah. Thank you.
Thanks.
Jody, go ahead. I forget to keep the light on.
That's okay. Sure. Thank you very much, Madam Chair. I can speak to part of that. I didn't hear the full question, but first of all, in the state of Colorado, if a person takes the AARP driver safety course, their provider must provide a discount. Now, that is very broad language. It could be 1%, it could be 10%. It really is up to the insurance policy. But know that in the state of Colorado, that is law. The other side of that is we have actually been working with a local AARP driver safety course teacher and hope to be a host site in 2024 if all works out. If not, we'll post where those are going to be. But we have thrown our hat in the ring, as it were, to be a host location for semi-monthly, that right, every other month classroom site for their daytime classrooms, a classroom site for their AARP driver safety course. It's 4 hours. There's a minimal cost that covers all of the paperwork and books and that kind of thing. And then you end with a certificate that can be submitted to your insurance agent. So just wanted to throw that out. Be watching for more details as we get that sorted out.
Jody, do you know how long the permission lasts? Well, I'm not saying it straight here. Sorry, my brain's not working.
No, I agree. I appreciate that. I don't recall off the top of my head, but we can certainly ask that. We did host those when I was at the senior center. And we made recommendations of those over the years with other agencies that I've been with, but I'm not recalling at the top of my off the top of my head how long that discount lasts.
did
But it's
attend those.
lovely because it's just a 4-hour class. It's just a 4-hour class. And this isn't let's have a class and take away your keys. This is really understanding how our abilities change as we age. Everything from reflex changes to peripheral vision, how we need to may scoot a little bit closer to our steering wheel, how we may need to be a little bit higher, but it's really an awareness of how our abilities change to drive as we age. But I'll find out that question for you, Madam Chair.
Joe, did you want to make a comment?
My question was relating to the driver's ed opportunities and where, when we have an opportunity to need this information, how do we refer to a driving, for senior driving education?
So like the type of thing that we provide, is that what you're asking?
No, well, is it like the 4-hour class or is yours just the evaluation?
So we don't do the AARP class at our office, so Jody would probably be the best contact for where to do those.
It seems to me that if a person has not refreshed their memory or their knowledge of current rules of driving, it would make a big difference to just study the book first before going to have an evaluation. I think we forget that we might not know everything.
I think everybody should read that driver's handbook. Everybody should read.
Absolutely. Absolutely.
One thing we have available here, and we just got more printed, is the Colorado's Guide for Aging Drivers and Their Families. So that we published with CDOT funding, and that has some good, just like roundabouts, like sharrows, like some new roadway designs that are listed in there too. So that's a good resource for you guys.
Thank you.
Thank you.
Maria, did you want to have a comment?
Yes, I just had a question, and I'm sorry if I missed it. Are there any age restrictions? Like if somebody has recently had a health condition? I'm so sorry. My computer's kept me on mute. I just had a quick question. Are there any age restrictions if somebody now has a medical condition or a new disability? Would they also be able to utilize this program?
So for the funding through the AAA, it is age 60 and over and live in the 3 counties. Sometimes there are other funding sources that we can help people look for, the Brain Injury Alliance sometimes, so kind of depending on what's going on medically. MS Society is a great source. So we always encourage people to call and talk to our front office because they're pretty aware of funding options. But for this funding, it is age 60 on up.
Awesome, thank you.
Thanks.
I am just going to jump in for a minute. So we are coming up on time in some ways. We are a little over a half an hour left of our RAC meeting still. So I just want to encourage everyone to kind of pay attention, keep going. I know you want to present a little bit more about your other program, or, well, we could do a few minutes of it. Yep, for sure.
I was looking at the clock too, so
yeah, no, definitely give us a little update too. Okay. And then we can keep moving along. Thank you.
I just have one slide on this one, maybe 2. Skills to Care is the other program that we started more recently. This is based on needs that we are seeing in the community. It is a program for caregivers of people with dementia. The occupational therapist goes into the home, does kind of a home safety evaluation, but it's really focused on self-care for the caregiver as well as problem solving. So teaching them problem solving skills for certain behaviors. So like the initial evaluation is around, as a caregiver, what's making life difficult for you? Like what are like top 3 things? And so it could be a variety of things, but that's kind of what that's really focused on. I do have one more slide. We actually have more funding allotted to this program, and we didn't use it in 2023. And so this is kind of a debate for us, not just within the grant funding, it's also covered through Medicare. So we've been marketing it for about 2 years now. I see a huge need in the community, but we're not seeing a huge uptake in people taking us up on this offer, whether it's paid for through insurance or through the grant. So I don't think this is something that'll be in our next grant request. So wanted to put it in here, let you guys know. It's kind of a sad announcement in that respect. We will continue seeing, we have 3 evals lined up for December. We'll continue with the ones that we have and that are sent to us directly, but we probably will have to wind down on that one.
Terry, but does that mean you'll still do the program and just do it through Medicare? Or are you guys set up to bill Medicare at this point?
We are set up to bill Medicare. Without going into too many details, it's more the Medicare side of it that's causing us to rethink it. Not Medicare specifically, but Medicare Advantage. A lot of, there's just a lot of barriers, which is where the grant has been fantastic. So if somebody has a really high copay or we're out of network and they have no out of network benefits, the grant could fill in. But we're just having barriers from like all directions on that. Sadly.
Thank you. That was a terrific presentation. And I did not know what you did previously. Okay. Jen, could you give us a report on the strategic review subcommittee?
We currently do not have an update at this time, but we are still in search for our new chair. We have someone in mind, and I have been out of town and had some things come up, so I've not reached out to that person, but I will be as of today and the following weeks. So.
Fine, thank you.
Mm-hmm.
And Marilyn, I want to just jump in for a second. Membership subcommittee, Rosemary's not here, but we do have kind of 2 announcements in some ways today, because today is Bee's last day with us. I say that, and I don't know that she will take us up on it. But I just really want to take a minute to say thank you, Bee. As I was filling out cards today to share out with the RAC folks, you know, it just is, it's kind of hard to imagine that Bee won't just show up here, because we expect her to kind of be here. And you've just really graced this RAC with a lot of really, really strategic thinking and forward direction, and brought your own personal kind of professional background to the RAC to really make it great. One of the things that I've really appreciated from Bee is that she created the need for the RAC and then all the other committees to have an executive committee that meets, you know, to really talk about what are you going to do before the next meeting. Prior to Bee doing that, that was not happening, you know, just kind of, you know, hard to believe, you know, agendas would go out and the chair would sit down and run the agenda, and that would be the end of it. And Bee said, let's do something more. So that's been really a great addition to the RAC, and it's carried over to the other committees too. So thank you, Bee. And I don't know if anyone else wants to take a minute, and then I have somebody else to acknowledge as well. But if anybody else wants to say a few things to Bee, you know, again, I think we'll have enough time to spend a few seconds here and say anything. Jody.
Thank you so much. And B, I can't see you right now, but I just want you to know what a delight has been to serve with you. I actually there you are. I got to serve with you, of course, for during my time as a RAC member before I came on staff. And your wisdom, your professional insight, just the experience that you bring as a professional, and just putting yourself in the shoes of of both our providers, but most importantly our clients, has been a huge help. I know we'll continue to see you on Mondays, because she does answer our INA phones on Mondays, and now that you're not on RAC, you can pick up another day or two. Just kidding. I know B is one of those one of those very important persons out in our community, and so but you know, you would always be welcome. But I want to share a little story real briefly. As you know, we've been been part of the advocacy of the homestead tax exemption, both expansion and portability. And last year we had the opportunity to testify on that. And I sent that invitation out to our RAC members, had a couple people raise their hand. B in particular came on and she responded to me. She goes, I don't know what to say. I don't know how to do this. And I said, no sweat. You're just like everyone else. You get the same 3 minutes to share from your heart how this is going to affect seniors across the state of Colorado. Well, we both get online, and that particular committee chair says, "Well, we only give 2 minutes in this Senate hearing." But I will say that she did a wonderful job. I know she probably prepped for hours for that 2 minutes. But I do want to share that it's been an absolute privilege to get to know you both. From a fellow RAC member, but also as part of the Area Agency on Aging staff. And don't be a stranger, and make sure that you stay connected. But like I said, for those of you who don't know, she does come in on Monday afternoons, or is that Monday morning? I can't remember. But to help with our INA phone calls that come in. So thanks so much, B. You are so appreciated, and you will be missed.
All right. And so Jen?
Oh, B, I want to echo a lot of that. But for me, ever since I've been on the RAC, you have been such a leader in our group. You have been so generous with your time and willingness to always pitch in. When you show up, you are 100% invested in whatever project we've done. It means so much to me for what you've taught me along the way. I'm going to miss you a lot.
Oh boy. And the other person I want to acknowledge is Jen. So Jen, has served her full 2 terms. She's done a lot over the last 6 years on the RAC. And, she is going to continue in a leadership shepherding role for the Strategic Review Subcommittee. So we'll still see a lot of Jen, but just again, taking a moment to acknowledge the time that she has spent and her professional dedication. I'm grateful that CCHA and everyone else who is still working for other organizations has the opportunity to be a part of the RAC. And so it's been huge. I think Jen's brought CCHA resources to our table as well that has made the AAA stronger. So thank you, Jen. And luckily, Jody's going to jump in and say something.
Thank you, Melissa. This is tough. I feel like I'm stretched across 3 time zones here, and just want to take the opportunity to acknowledge your time, Jen, in this. We met outside of the AAA environment as she came into Colorado Springs, working within the senior services community, and it was very easy to recognize very quickly just her passion for serving the community and our older adults and those in need. And so when we both served on the RAC, and in particular, I got to serve with Jen and B in the most recent, not this one that we're currently in, but the last 4-year planning process, ultimately creating what we now know as the SRS. I knew it was always going to be a good meeting, and to this day, I love the fact Jen comes in. If you haven't been paying attention, Jen comes in. She knows where I go, and I can see her face. Jen comes in and she pulls out 2 pouches, and there's pens and different colored markers and different colored pens. And I love that about her. She comes prepared. She comes ready to create action items. And I would share much of what you actually said around B, is that you are 100% in to what you do. And so that has been much appreciated, especially during the time of our most recent four-year plan process. As you well know, this most recent four-year planning process was very, very new to just about everyone in the room that participated in that. And you took that on with such grace and participating in so many of the meetings. I'm really proud to share, and those of you who have not heard this, by legislation, we are required to host 3 public meetings around the planning, and we hosted 32 across our 3 counties. And Jen and several others were a huge part of that process. And I just so appreciate the time, not just the time in showing up to the meeting, but being so prepared before and after to really engage in the process. And so, Jen, I know we'll see you around, but you will certainly be missed as part of your RAC role. And I love it that you're staying on to help shepherd the new person into the SRS chairperson role. So thanks a bunch, friend.
Jody, before you give your director's report, would you give us an update on the Strategic Review Subcommittee?
Or TRS.
TRS?
Yes, I'm very happy to. In fact, if you look at your agenda, actually, I'm going to touch on the RFP process just to bring you up to date there first. And so just want you to know that at this point, we have released the RFP. Melody and I, either together or separately, have begun meeting with interested providers who are interested in some of the funding. And that is the overall primary funding, contract funding for July 1 of 2024 through June 30th of 2026. That is our 2-year contract period coming up. So the RFP was released. We have already hosted the RFP conference. That's also another one of those requirements that we do. Our staff did a really fantastic job. We had Melody, Melissa, Laura, Carol, Emruda, and Noemi, those last 3, of course, from our finance department, all engaged. We had a variety of providers in the room, as well as some online. We did record that, and that information has been shared out to those who either want to refer back to that meeting content or need to share that with other staff. So it's moving along fast and furious, despite the fact that we did expand the time period this year. I will share that between the AAA staff and our finance department, there's been a lot of work going on to create some efficiencies in the overall process, and that is why we were able to expand the RFP time period. So the RFP will close January 19th, and staff will begin reviewing those requests. As usual, we'll do some initial steps. For example, we'll review all requests, determine what are valid requests based on the funding. We will also look at funding parts. We will work up initial recommendations to the TRS committee, and then TRS and staff will meet. We hope to have recommendations. I don't have the full timeline in front of me here, so Melody, if you have that handy, that would be great. But what we'll do is we will be going through the usual process. We will have our TRS meetings. We'll determine the final allocations based on funding and amounts. We will also, funding parts and overall amounts from the feds and the state. Then we will bring that to the RAC. The RAC will then make that recommendation to the board. We take that to the board of directors. And when that is finished, then we're ready to complete the contracting process. One thing is very important to understand. At this point, we have no idea what our funding is going to be. It's actually one of the conversations that we've been having here at our U.S. Aging board meeting. The U.S. Aging is essentially our membership at the federal level, advocacy group at the federal level, and talking about programs and funding and everything as it relates to the federal process. It's very important for you all to understand, and this is something that we did share with our providers. At this time, we don't know what that funding is going to look like. We don't know what that amount is. We don't know how it will be distributed among the funding parts. And so what we're doing right now is we will be working from the assumption that, as we know, both our federal and state funding will likely at least be flat, if not even just a little bit lower, which is very unfortunate and frustrating across the board, as you might imagine, because we're seeing such a great need in our community. But that's what we start with, just so we can get a lot of the operational work done out of the way, all the permissions. If we have not received final numbers by the time we are ready to bring the proposals to the RAC or to the board of directors. In fact, if you'll take off this screen, this is not the presentation I'm working on. That would be a big help. Thank you. We'll get to that in just a moment. But with our RFP that's current, we have to go ahead and get a lot of this work out of the way. Otherwise, we would not be able to come to a July 1 contract period, because there's a good chance that we will not know our actual funding amounts and funding parts until very, very late in the spring. March, April, May is not putting it too lightly. We just won't know. And so there's so much work that we need to do internally and for planning purposes to make sure that we can achieve a July 1 start date. So we have shared this with our providers. They know that we don't know yet, and we're not hiding any information. We're not holding back details. We just won't know this information from the state for a few months yet. So we will go through that process and make sure that we can keep to our timeline and make sure that those funds are available as soon as they are released. What we have done in the past is, if we don't have those actual dollar figures by the time we get to the RAC meeting or by the time we get to the board meeting process, we will request a contingent approval based on the process, with the understanding that fund distribution will adjust either up or down depending on the final allocation from the state and the feds. So we are going to continue working through that process, and we will certainly be keeping the RAC informed as we go through that. Okay, let's go ahead and move into the carryover. So if you would share that letter up on the screen, I would appreciate it. So overall, this year, we're pleased, and I will let you know it's a bit of a conflicted feeling that the Area Agency on Aging received $189,522.02 in our federal carryover, and that's just exactly what it sounds like. These are unspent funds from the previous federal carryover or federal spending year, fiscal year. And so there's pros and cons to this. It tells us that we are spending more closely in line with the funding that we receive. However, it does continue to show that we have a little bit of work to do yet to make sure that we're spending down appropriately, so that is not seen negatively by our state and federal partners. However, as you pop down and take a look at that third paragraph, our overall needs assessments, when we sent this out to our providers, shows that and these were valid funding requests, which meant that if we had $839,000, we could have funded all of these appropriate. appropriately. But our valid funding request totaled $839,228.32 compared to the actual final number after admin is taken away, because we can't spend that on services, as well as appropriate indirect costs. The actual available for distribution was $145,414.71. And so you can see there in our funding update, there's a huge difference, a huge gap between what we're able to spend on needs. And again, these are already validated providers. These are valid needs, and these are valid requests. And so what I've told our providers is, at the end of the day, this still helps us with our story, both to the state and to the feds, that shows, look, we're spending all the money you give us, or almost all of the money you give us, and yet we still have, if I had another $500,000, we could put that into the community tomorrow. And so this does help with the story. It just doesn't serve our Mr. and Mrs. Smiths across the community right now. So what we did with that huge gap, if you'll scroll to the spreadsheet, that'd be awesome. What we did is, with this huge gap, we of course went to our 4-year plan. That's exactly what it's intended to be used for. Now, a couple things that I will share before we get into the specifics. All of our funding now, whether in our base funding at the beginning of our state fiscal year, or our carryover, as you see here, are now being distributed by part. What that simply means is that within Title III, as Amy alluded to earlier, Title III is our primary federal funding. Those funds come to us by very specific part. So some parts were funded, and that's simply because we did not use those funds previously in the previous fiscal year, or there were no funds at all in that spending part because we did spend down those funds within that previous federal fiscal year. So understand that it's quite a puzzle to put together. What we chose to do was go to our 4-year plan. The top 2 areas, and this is not to play down any other service area, please understand, but the 2 top service areas that we continue to see needs in were transportation and nutrition. And so what we did is we took the request for transportation and nutrition. We took those requests. We applied a 30% 30% to that, and that is how we have that final proposed amount. And so what you see very the second line there, disability services, of course, that's our folks from Invita. Their request was $150,000 for assisted transportation. As you can very well see also, that is $5,000 more than available in the entire pot of carryover funds. And so we did the math. 30% of that is $45,000, and we applied that to their request. Going on down the line there, Fountain Valley Senior Centers, 2 requests for assisted and regular transportation of $22,500. 30% of that is $67.51. On down the line, Project Angel Heart, which of course is our modified meals nutrition program, had a request for $132,840. 30% of that is $39,852. If you would scroll up, please. Silver Key's request was actually across both their congregate, was primarily focused on their congregate meal and home delivered meal programs for a total of $26,691. 30% of that is $8,007 and change. Teller Senior Coalition had a little bit broader request. As you can see there, they had 6 line items with priorities, which actually aligned with the priorities of the 4-year plan: assisted transportation, regular transportation, and their home delivered meals, for a total of $111,022. $22 in their request. 30% of that equals $33,229.63. All the ones in gold were funded at 30% of their requests, except for Teller Senior Coalition. We reduced that by $76.97 because that was the overage after 30% adjustment. But you'll see the orange amount there, the Voucher Caregiver Respite Program. That comes from a very small, narrow requirement pot that could not be used anywhere else. It could only be used based on these requests, could only be used within that voucher respite program. And so we had drawn some as part of the federal requirements of the indirect costs that we have to take out of the funding. That balance was $12,574.59, and we applied that to that respite program. That does complete that very last column there on the right. That does make 100% carryover allocations of the $145,414.71. The process this time was a little different. A few years ago, it was determined that anything under $200,000 in carryover could be distributed by staff without any formal approval process. I'm not real comfortable with that because we are a public agency and we do have the TRS as our public representation. So what we did is we did a little bit of a modification. We went through, made these recommendations, and we engaged the TRS members as part of this conversation and the process that we took. So I want to thank B, Jim, Marilyn, Debbie, Laura Kronig, and Joe Ruth for having a hand in helping with this process. There were some good questions that came out of it as to, you know, what kind of some service definitions and questions about the funding. But all in all, it was unanimous to support these staff recommendations. At this time, the allocations have already been made. Contract amendments have been made. These funds are already in their contracts and updated. So we're at that point where we, because of the way the bylaws state, we don't have to go to a vote for this. This is just for information only, as you can see there on the memo. So just wanted to share that with you. It's really positive that this federal carryover is so low because ultimately the state is planning to implement a cap on our carryover funding, and we're doing everything that we can in planning to ensure that that does not happen. A couple of things from the provider side, they may do transfers inappropriate from appropriate parts to other parts. And so if someone has funding in one area that they're not seeing as high a usage, they are allowed to move those funds. And we have shared those that information with providers, and some of us have taken us up on that. And so that is already taking place as well. The other side of this is ultimately because this we're working on this carryover, we will continue to use these needs assessments as we review overall funding in the coming quarter. We will be taking a hard look at spend down. Providers may be contacted by me and Melody in particular as we look at spend down. There may be occasion where we ask a provider to revisit and select a particular amount of funds to move away so that we can free those up and provide them to another provider who is seeing an increased need, maybe in a similar funding pot. So just wanted you to know there's a very active process. The needs assessment serves both the carryover and ultimate spend down process to make sure that we're not raising any red flags to our state and federal administrators and that we are using the funding as is intended. So With that, that finishes my report. I will hold off on all the things that we've learned this week here at our federal board meeting. 'Cause there's a lot going on, but I will reserve that time for a future meeting. So I'm happy to entertain any questions that may come up.
I don't see anyone raising their hand. So we'll say thank you for the update.
Thank you. I appreciate it. And again, appreciate the TRS for engaging in the process, and hold on to your hats because we'll be doing it again in the spring.
Well, I want to thank you for participating in the meeting today. I think we all participated quite a bit more than usual, and that's great. I'm going to make sure we stop before the 12. We got a minute and a half left. So I'm just going to say, I hope you have a happy holiday season, and we'll look forward to seeing you in January. And the January date of the next meeting is the 25th, Thursday, January 25th. Any other discussion items? Yes, Ruth.
So Joe said, thanks for the treats, Jody. All right. Take care, you guys.